The modern swine veterinarian must be proficient at 3 activities that also describe the tripartite mission of Iowa State University: teaching, professional practice, and research. The Swine Medicine Education Center resides at the interface of these missions and seeks to serve the modern swine practitioner and the health and welfare of pigs in all 3 arenas. The Swine Medicine Education Center isn't a bricks-and-mortar facility, but rather a unique and productive cooperative effort between Iowa State University and AMVC LLC that seeks to use existing resources to create the premier training ground for swine medicine. Iowa State University College of Veterinary Medicine is responsible for research, development, and review curriculum content and recruiting students to maintain integration of the degree programs. AMVC provides farm access, supports veterinarians to develop and implement curriculum, and provides fully furnished student housing and transportation. Most importantly, AMVC helps to inform the curriculum with real-world examples and a real-time understanding of emerging opportunities in swine health and production. The center is guided by a board of directors that includes Drs. Pat Halber, Butch Baker, and Darren Madsen from Iowa State Veterinary Diagnostic and Production Animal Medicine Department. The board of directors also includes postdoctoral research associate alumni Dr. Jessica Bates, and Drs. Daryl Olson, Jason Hooker, and Josh Ellingson from AMVC. Dr. Carricker serves as director and manages daily activities in Ames, Iowa with a dedicated staff of swine expertise. Center logistics are organized by Kristen Skoland, and Drs. Paisley Canning, Anna Forsa, and Justin Brown participate in all the tripartite mission activities for a postdoctoral experience that creates true triple threat practitioners with skills in research, teaching, and professional practice. Dr. Josh Ellingson serves as Associate Director, and he, along with Dr. Paul Thomas, an Associate Veterinarian with SMEC, are based in Ottoman, Iowa, and are employees of the AMVC system. Success of the center depends on daily communication between ISU and AMVC. As our name implies, the primary focus is on teaching. Our driving curriculum goals are to demonstrate live and capture digitally every clinical technique in swine medicine, practice, research, or production. Provide students a place to practice these techniques that is safe, protects animal welfare, and is technologically current. And incorporate traditional knowledge-based curricula to teach students the rest of the skills needed for practice areas of business, finance, epidemiology, swine-specific pharmacology, vaccinology, animal welfare, sustainability, food safety, and more. We use a variety of technological platforms to carry out these goals. For example, we have developed a lecture series that is available online and incorporated into the core curriculum of several veterinary colleges. Traditional recorded lectures are supplemented with live conference calls with SMEC instructors and students to review exams and field questions. Instructors are available at any time using typical chat room functions that forward student questions and comments to instructor email anytime, anywhere. These recorded lectures include case examples, with client permission of course, that provide students with realistic presentations of disease and context for applying general principles. We'll leave you with the link to our website at the end of the presentation, since it is the best place to find out what courses are offered and when they are taught. It is a link to find out when 2-week on-farm clinical courses are scheduled. These courses are intensive 2-week experiences targeted for 4th-year veterinary students that focus on a particular topic and spend most of the time on modern swine farms solving client cases. SMEC 480 is a capstone course that teaches approximately 21 clinical techniques such as serum sample collection, restraint, necropsy, farm evaluation, and treatment plan development. Regardless of a student's skill level or experience with pigs, this is the course that can get them ready to successfully manage swine cases in practice. SMEC 478A will give participants the opportunity to learn swine production management and consulting skills within a progressive swine production and management system. It is a combination of classroom discussion topics of finance and business of the swine industry and on-farm learning opportunities where students will visit a breeding farm, nursery facility, finishing facility, wean-to-finish facility, gilt developer unit, and a truck wash facility. Swine production management and consultation is based in the AMVC system and essentially considers every other influence on the pig beyond bugs and drugs. Students often elect to take these two courses together. The center also offers a 2-week clinical course focused on clinical pharmacology that explores swine-specific considerations for judicious drug use and troubleshoots client treatment programs to improve efficacy. A 4th clinical course has historically focused on porcine, reproductive, and respiratory virus diagnosis and management, but is now being expanded to deal with emerging and re-emerging diseases, including porcine epidemic diarrhea virus, or PED, and Seneca virus A, or SVV. The Pig Pro seminar is a 3-day on-farm experience for non-veterinarians and allied industries that would benefit from a better understanding of the structure and function of modern pig production. Participants in this course, such as sales staff for biopharma companies, report improved rapport and efficacy with their customers. The Swine Medicine Backgrounder and Maximizing the Value of Diagnostic Submissions, PERS Diagnosis Review, are online reviews targeted for veterinary students and available on demand as needed. Feel free to use the contact button on the website to contact us for further information. When we can't take the students to the farm, we bring the farm to the students and practitioners with a rapidly expanding library of training videos that demonstrate clinical techniques such as nasal swab collection in this case. Our library now contains 62 videos with 498 minutes of instructional footage. Topics range from tours of production facilities like boar studs that are difficult to access in person due to biosecurity restrictions, to surgical techniques like epidural anesthesia and necropsy. The center has the equipment and expertise to produce these videos in-house, which keeps the content experts involved in the video production process to shorten production time and improve technical accuracy. One feature of most SMEC courses is dynamic interactive case rounds discussions. This recent session was guided by 5 swine-focused veterinarians and former production manager. The referring veterinarian for the case was connected via the web for real-time follow-up and insight on the case. 12 students from 4 different veterinary colleges participated in the discussion. Often these case rounds discussions visit a number of topics, and they also integrate welfare, judicious drug use, economic and performance considerations with traditional bugs and drugs discussions. Case rounds discussions often follow a farm visit, which typically occur on AMVC and ISU client herds across the Midwest. The Swine Medicine Education Center is convinced that the best classroom is the farm, and SMEC is fortunate to have many local and regional opportunities to collaborate on client cases. This time-lapse shows students learning to restrain pigs safely while managing the remaining population in the pen so they can collect serum samples for antibody testing. Being able to learn in the barn environment gives them a complete picture of how to prepare and successfully complete the activity in a realistic setting. This intensity of experience cannot be recreated in the classroom and distinguishes the training available at the center. Student training on farm takes advantage of naturally occurring disease and routine production monitoring objectives, which means that the real component of the training is service to the client in the form of professional practice. Students are in a position where solving the problem and improving animal health is a real requirement of the training. It also means that a wide range of exposures is possible and that these exposures are consistent with current pig production challenges. From 2012 to 2015, 230 students visited 277 farms and evaluated 921,227 pigs as part of the Swine Medicine Education Center program. These client cases drive the third mission of the center by providing applied research opportunities that allow students to develop the skills of evidence-based scientific inquiry addressing a question of benefit to pigs. This example resulted from a student observation about the variety of bulbs and heat lamp reflectors on a farm and asking which one was best. Eventually, the trial she designed was reported at the American Association of Swine Veterinarians Student Scholarship Contest, and the less efficient bulbs were eliminated from the production system, resulting in a tangible cost savings. We tackle more complex research projects in support of industry needs as well. One area that is important to the swine industry is addressing concerns that traditional processing practices on piglets may cause pain. SMEC won a competitive grant from the Iowa Livestock Health Advisory Council to see if non-steroidal anti-inflammatory drugs could be administered to sows orally and transferred to nursing piglets via the sow's milk. This pilot study is the first to demonstrate medication of piglets by dosing the sow, and with further study may lead to new tools to manage pain in piglets. Occasionally, practice and research activities reveal that we need better techniques for swine medicine and research. When we encounter these deficits in the knowledge domain, we take an evidence-based scientific approach to developing and testing new techniques. In this example, a limitation to pharmacokinetic and stress response measurements in sows was encountered, and we solved it with systematic development of a new technique for auricular vein catheter placement. Publication of the technique gets in the public domain for veterinarians and researchers to use. Concurrently, it is integrated in the center's curriculum arsenal to further grow teaching resources and enrich the student experience. You might wonder how much teaching occurs at the center and who the students are. In 2015, we provided 61,772 student contact hours. Since our inception in 2011, we have been visited by students from 24 veterinary colleges and graduate programs around the world. When you consider all participants in courses at the center, we have impacted people and hopefully pigs from 31 countries. We appreciate you taking the time to learn about us. If you want more information about courses, the latest applied research developments, and summer internship opportunities, be sure to visit our website at www.smec.iastate.edu. If you have ideas for collaboration in teaching, research, or professional practice, email us at isusmec@iastate.edu.